Okay, so this is the normal male genital organ. This is the penis, the scrotum, urinary bladder, right? So we are talking about the cryptorchidism. So here, like this, this is the scrotum. Scrotum contains the testes, right? When baby are intrauterus, that times the testis is developed inside the lower abdomen. By the time in developing process, testis should be going descent downwards towards the scrotum, right? Like abdomen, then they, during the developing process, they come in inguinal canal, then go down more, go through the inguinal canal and finally come to the scrotum, right? So this is the normal way. I said when baby are intra-abdominal, I mean inside the uterus, the testis is grow in the intra-abdomen, and during the developing process, testis supposed to go descend. Abdomen, inguinal canal, then passing the canal, and finally come to the scrotum. But if something is happened congenitally, the testis does not coming down and does not come in the scrotum, right? And this is called the cryptorchidism. So cryptorchidism, it is a condition where both testes or one testis is failed to descend through the inguinal canal into the scrotum. So when doctor examine the scrotum, they will not palpate the testes inside the scrotal sac. So testes are not palpate easily inside the scrotum. This is the problem. So monitor during the first 12 months of life. We has to, when you go to the regular follow-up checkup to the primary doctor, they should check everything is okay or not. So monitor during the first 12 months of life to determine whether the spontaneously descending to the scrotum or not. After age 1 year, medical or surgical treatment be needed, right? Surgically correction may be needed. So this is something is little bit important about this. Human chorionic gonadotropin, this is the hormone, gonadotropin hormone, which is help to develop of the gonad or sexual organ, or a pituitary hormone that stimulates the production of testosterone, may be prescribed for the old children. So if the testosterone or testis does not work well, the men or boy children will not develop like secondary sexual character, muscular body, broad chest. This is the typical feature of the man. So because of the testes, if lackings of the testes, the boy will not be like a boy. So surgically correction is the management, right? Another terminology is very important. We have to know for board exam: Epispadias and Hypospadias, or Epispadiasis or Hypospadiasis. Epispadiasis, what it is? Epispadiasis or Hypospadiasis are the congenital defect. So baby problem during the birth, congenital problem, abnormal the placement of urethral orifice of the penis. That this anatomical defect can lead to easy to carry bacteria to the, so like Epispadias. So this is the penis and this is the opening of the urethra. So this is the opening supposed to be the tip of the glans penis, right? It should be the tip, but unfortunately, because of developmental error or congenital malformation, they open on the dorsal surface. So dorsal placement of urethral opening, urethral meatus on the dorsal surface is called Epispadias. But sometimes it is in dorsal surface. So if the opening is failed to the tip of the penis or malformed, congenital malformation, if it is open on the ventral surface, ventral placement of urethral opening, this is called hypospadiasis. Epispadias and hypospadias, because of this opening, the urinary tract infection is more common. So urinary system is easily get infected, right? But keep in mind, if the baby develop with that kind of problem, it should be corrected, reconstruction by surgery. So what we have to know for NCLEX board, Epispadias urethral opening is located on the dorsal surface of penis, and the condition is often occurred with extratrophy of the bladder. And hypospadias urethral opening located below the penis, glans penis, and along the ventral surface. So penis has two surfaces, one the dorsal and the ventral. If it is a dorsal surface called hypospadias, if opening on the ventral surface called epispadias. And what are the management? Surgical management, surgical intervention. So surgery is done before the age of toilet training or performed between 16 to 18 months of age, right? Here are the two important points we have to know. So some of the religious people do the circumcision. So if the baby has a epispadias or hypospadias, it is better not to do the circumcision, right? Because the surgeon used the foreskin during the repair of epispadias or hypospadiasis. Let me read what they wrote. Circumcision may not be performed on a newborn with epispadias or hypospadias, although there are other surgical techniques used the repair of this foreskin for the defect. Pediatrician may prefer using the foreskin for the surgery. So actually what happening, so this is the glans penis. Glans penis is covered by a foreskin. During the circumcision, this foreskin is removed or cut out. But in case of this problem, the surgeon used this foreskin to repair or construction of this problem, right? The surgeon use, pediatrician surgeon use. So this is the very basic information we have to know about the Epispadias and Hypospadias.